Firstly, I have a trigger warning or content warning. I am going to talk a little bit about birth trauma, as well as NICU stay and infections, sepsis, things like that. So if you are sensitive to those things, definitely be aware, or maybe switch off now. If you're new to my channel and my story, here's a really quick rundown. My husband and I became pregnant in November of 2022 through IVF. That was after 7 years of trying. We had one embryo implanted. That embryo split. However, we did not find out until 13 weeks that we were pregnant with twins. At 22 weeks gestation, I was diagnosed with Twin Anemia Polycythemia Sequence, or TAPS. And in the same week, my mother passed away from terminal cancer. After that, we had 2 in utero transfusions, and my girls were born at 33 plus 6 weeks gestation. I talked in my last video about the birth of the babies and how amazing that was. Although when the girls got to NICU and they were quite stable, a lot of things happened after then. So I gave birth on a Wednesday night. On Thursday, I had a very early visit from my maternal fetal medicine department doctor again, and he obviously congratulated me. That morning, I also started expressing, and then I was able to go down and visit my baby girls in NICU. It was about 12 hours before I got to actually hold my baby girls. They were in separate isolates in separate areas of the NICU room. Now that day, everything seemed to be going all right. The babies were doing well, and they were just monitoring breathing. They were feeding them, so I was getting regular updates every time I went into NICU about how they were doing. We had to sign several forms. We had to consent to like a vitamin K injection, hepatitis B vaccine, as well as several blood tests. So we were just constantly signing papers every time we went into the NICU. My recovery was quite brutal. I do believe that I suffered birth trauma. So birth trauma is really in the eye of the person who experienced it. And for me, I didn't get the birth that I wanted. I didn't get the pregnancy that I wanted. My choices were taken out of my hands from the moment that I was diagnosed with TAPS. And that was really hard for me. Even up until the last couple of days that I was pregnant, I was still asking if I could possibly do a vaginal birth. When I arrived at the MARTA, one of the doctors said that because one of the girls was head down, that they might consider a vaginal birth for me, even given the TAPS. So my expectation from the beginning was that it was going to be a planned C-section, because they wanted to mitigate risks. Obviously, they can only tell so much when the babies are in the womb through ultrasound. So if I was to be induced and the girls became distressed during childbirth, obviously that would add another factor to prematurity and the TAPS. So to control the situation, my understanding is that they would do a planned C-section. So when this suggestion was made to me that I could possibly have a vaginal birth, obviously I was very kind of excited about that. And I said to my MFM on the Wednesday morning, is it possible? This is what this doctor suggested to me. And of course they came back with the answer that no, as much as we think that your girls are doing well, we just don't want to risk them becoming distressed on the way out. But obviously for me, my only thought was getting our babies safely earthside. So it didn't matter. I just would have preferred that. When I got pregnant, I knew that this was going to be our first and last chance. We weren't going to do this again. I'm 43 and I don't want to be older than I already am. A lot of choices or things that I wanted to do were not possible because of the TAPS. We wanted to do all the things. So I didn't get the vaginal birth. I also didn't get the breastfeeding experience that I wanted. So there are a lot of things that I didn't have. And I think that had we gone to a planned C-section and it had been in the environment that I was really comfortable with MFM and during the day, I would have been much happier with that. Now, I can't fault the doctors who my team that were there when I gave birth. They were incredible and they have no part in my birth trauma at all. Just wanted to have a bit more control and I had nothing. The only control I did have was having that playlist. That's it. I do believe that there is some trauma there and it was not the experience that I wanted. It's not what I wanted for my husband. I really wanted my husband to be there. It's probably mostly pregnancy trauma though. Anyway, that brings me back to days in the aftermath of the girl's birth. So everything was seemingly going well on the Thursday and Friday. I was trying to get sleep, but I was in extreme pain. Like, it was so painful. And the suggestion was made to me that because I had twins and there's a lot more stretching and a lot more shifting of organs, that's possibly why I was in so much pain, but it was to the point of being uncontrolled. They wanted to release me or discharge me on the Saturday, and in no way was I ready to go. I could barely walk. I was still in a wheelchair. And every time I asked for pain meds, they'd give me like half the dose instead of the full maximum dose. So it was just, it never got right. And I was just in constant excruciating pain. Anyway, come to Saturday morning and a doctor walks into my room and says, "Did you know that your baby's had an E-coli infection?" And I was really puzzled. I had no idea. This was the first time I'd heard of it. On the Friday evening, I went down into the NICU and they had isolated the girls or put isolated barriers around them. And the reason for that was an antibiotic resistant bug that they picked up on my skin called ESBL. And I tested positive for that. It meant that the bubs needed to be in isolation until their test results came back, just in case I'd passed it on to them. Now, I didn't have this infection when I was swabbed at the Gold Coast on the Saturday night before the birth. It was picked up when I was swabbed on the Tuesday when I arrived at the MARTA. So at some point during my stay in hospital, I've picked up that ESBL, that antibiotic resistant bug. So I was aware of that. But on the Saturday morning, they also told me that I had E. coli on my placenta. What that meant is that baby B or twin 1 had also contracted that E. coli infection. And that was just horrific news. It was so scary to hear. And it was something that I blamed myself for. Like, the infection was present on my placenta. So somewhere along the line, something had gone wrong. I didn't understand what at that point. And it would later be explained to me what exactly happened. So on the Saturday, they found that the bubs didn't have ESBL. Billy, my twin 1, or baby B, whose sac had ruptured, she was the one that had the E. coli infection and Poppy did not. It was a very, very hard day. We had to consent to a lumbar puncture on a 2-day-old baby. And so we knew that the E. coli was in her blood. Her blood culture had grown E. coli. And it was so scary. But also seeing her go through a lumbar puncture was just horrible. They put up screens, but I still had to kind of hear her cry. It was just awful. And the first lumbar puncture didn't work. I had to consent to a second. I later found out that they attempted a third. They were unable to get the lumbar puncture. So our poor little Wilhelmina, Billy, had to have 3 weeks and a long line of antibiotics just to, as a preventative treatment, just in case meningitis was there. So yeah, we didn't know what that meant and what her future held, and that was really, really, really awful. So Poppy was doing great. By the third day, by the Sunday, she was already off breathing support. But our poor little Billy on the Sunday had a long line put in, which was really, really hard. And through all this, I was trying to negotiate with the hospital to not release me yet because I still couldn't walk properly or anything like that. The other issue with my recovery is I had to be able to be up and walking because I wasn't staying at home. I was in Brisbane, so I had to stay at a Ronald McDonald house, which meant that I was travelling from a Ronald McDonald house to South Brisbane to the NICU every day. Because of the ESBL, a decision was made to put me in isolation. So that meant I got my own room, which wasn't all bad, but there was confusion about whether I was allowed to see the bubs, whether I was allowed to leave my room. And there was a midwife that said that I wasn't allowed to leave my room, which was just unbelievable. I'd been walking around the hall all night and all day and back and forth delivering breast milk. And all of a sudden it was suggested to me that I can't go to the NICU because I have this ESBL. Later on, it was explained to me that ESBL pretty much lives on everyone's skin, and it's not necessarily dangerous, but it can be dangerous to babies and elderly. So as long as I was like scrubbing up, I was fine to go see my babies. When we got to Monday morning, I had a visit from MFM, and I was so excited that they were there because they were able to explain a lot of things to me. The first thing they asked was, why are you in isolation? And I said, I don't know. Someone's yet to explain it to me. And they were able to take me off these contact precautions or isolation, which was really, really good. I was very, very happy about that. Because I'm in a isolated room, which was good, but also people had to wear aprons and gloves to come and even give me medication, which also hindered my recovery because they just had to get in and out. So it was just really, really stupid. Anyway, so the contact precautions were taken off, thank goodness. They actually did an investigation on the Monday to find out, how did I get an E. coli infection and how did Billy then get that E. coli infection? And I wouldn't find out until the Tuesday what had actually happened or what their theory was. Given the go-ahead to be discharged, at that time they'd found another pain solution for me, which was really good, and it finally worked. So I left the hospital that afternoon, and I came back on a couple of days later for a checkup. And it was at that checkup that I found out that their theory about what happened and what led to Billy's E. coli infection was this. So there was a couple of possibilities. The first one was that I could have got an infection in my placenta from just having that second in utero transfusion. They don't believe that's likely. Looking back at all my medical records, what they do believe is likely is that I acquired the E. coli infection after my waters broke. So the most likely scenario was that my waters broke, infection got in, poor Billy got that infection as a result of her sac rupturing. And that's why Poppy didn't get the infection. Now, this theory makes sense to me because I did have swabs on the Saturday night before I gave birth at Gold Coast. E. coli and ESBL were not picked up at that stage, but I was swabbed at the Mater and on the Tuesday after my waters broke, and when I was admitted to the Mater, and they picked up on my swabs both ESBL and E. coli, and then obviously E. coli was picked up on my placenta later. Yeah. At least I have an explanation for what happened, and I also have the pathology report from my placenta. So that's what happened. After that, the girl stayed in NICU for 11 days. Poppy was actually moved out of NICU and sent to special care for 1 day. And then we were transferred back to the Gold Coast. So thankfully I only had to stay, I think, 4 nights in Brisbane at the Ronald McDonald House, and which was brutal because I was still recovering. I had to be propped up on pillows and things like that so that I could get out of bed, and I was pumping in this hotel room, which was really, really hard. So I was very, very thankful when they got a transfer for the girls to go back to Gold Coast Uni Hospital. And they went to special care there. So even with Billy's long line, she was able to go into the special care high dependency unit, and they kept Poppy by her side. So they went into a twin cot there, which was just amazing. What's really amazing is that Billy was having a lot of trouble coming off breathing support. She was on CPAP for almost 2 weeks. When she went to the Gold Coast and she was finally by her sister's side in the same cot, she was regulating her temperature. She was pulling the prongs out of the CPAP. She was ready to breathe and regulate her own temperature. And it's just fascinating to me that while they were separated, she just wasn't advancing the same way. But as soon as she was next to her sister, things just looked up immediately, even though she was really sick from this infection. So that was great to see. Marta were just phenomenal. I can't fault them. It's just very annoying that they didn't have a twin cot. That's what I would wish for them. And at the Gold Coast, the rooms in the special care are just phenomenal. Yeah, so they stayed there for a further 16 days. So all up, their stay in hospital was 27 days, and then we were able to bring them home. I'll save the NICU and special care stay for another time. I can go into detail about that in another video. So thank you so much for watching. If you have any further questions or comments, please pop them down below, and I'll see you in the next video. Bye.